You know, it's hard to see a family member battling cancer or any life-threatening disease. Proton therapy is a precise form of radiation for a variety of cancers, including prostate. The treatment's accuracy works to eliminate cancerous cells while minimizing exposure to healthy tissue. It sounds interesting, so I recently took a trip to Texas Center for Proton Therapy in Irving to find out more. I'm here with Dr. Andrew Lee, the medical director for Texas Center for Proton Therapy. Good morning to you.
Good morning, Paige.
What is proton therapy?
Well, proton therapy is a unique form of radiation therapy that uses subatomic particles called protons that are accelerated to very high speeds in order to attack and kill cancer cells. And because of the physical properties of proton therapy, we can control the dose inside the patient much better than conventional X-ray therapy. Proton therapy can treat a wide variety of cancers. Basically anywhere where conventional radiation therapy can be utilized, proton therapy can also be used, and oftentimes more effectively. Particularly in situations where the tumor may be very close to sensitive structures, proton therapy's unique characteristics makes it a very good treatment option. For example, tumors of the brain, spinal cord, head and neck, lung, liver, and prostate all can be effectively treated with proton therapy.
Well, speaking of prostate, September is Prostate Awareness Month. Why is proton therapy a good option for treating that type of cancer?
Well, thank you for bringing that up, Paige. First of all, I encourage men to discuss with their physicians prostate cancer screening, because when it's detected early, the treatment options and the management options are much broader than when it's treated later. But one of the things about treating prostate cancer is we want to cure the patient but also preserve their quality of life. And since proton therapy can often treat just the area that we need to and minimize dose to sensitive structures like the bladder or the rectum, we can effectively treat the patient but minimize the impact on the healthy tissues and thereby improve their overall quality of life, not only during treatment but even years afterward. Oftentimes our patients are still working, and this treatment option affords them the ability to continue to do so. And afterwards, people want to try and maximize their quality of life following treatment for years to come, and we understand that, and that's why proton therapy is available.
Well, how has proton therapy evolved through the years?
So proton therapy is been used in the U.S. to treat cancer for several decades, as a matter of fact. But I would say over the last 10 to 15 years, the technology has improved substantially. And one methodology is to use something called pencil beam proton therapy, where instead of using a large beam of protons, we use individual small spots of proton. And it just allows us to be much more precise.
All right, so how does one make an appointment?
So you can call our center directly, 469-513-5500, or you can go to texascenterforprotontherapy.com. And it's important for patients to understand that they can either self-refer themselves or work with their providing physician to help arrange a referral. Our intake team is specialized to help patients and physicians to gather all the necessary information so that patients can make an appointment easily.
Thank you so much for this valuable information. We appreciate it.
It's my pleasure. Thank you.
All right, Texas Center for Proton Therapy is on West Royal Lane in Irving. You can call 469-513-5500 or go to texascenterforprotontherapy.com for more information.